So palliative care is medical care that's focused on optimizing quality of life in the setting of any serious illness. So whether that's something like cancer or heart failure, it's focusing on the quality of life piece. And it kind of focuses on three things: symptoms, communication, and decision making. So it's helping patients and their families think about issues around that serious illness, and may include then end of life care. Like, we need to be able to help prepare patients and their families for the event that things aren't going to go well. And so having that conversation earlier, and then being able to say, we're going to walk with you on this journey no matter what, right? Whether that means additional curative treatments or whether that means shifting the focus to palliative care. We're with you in this, but we need to prepare them for that possibility. And I think that's an area that we really need to improve upon a lot. I think family members do an amazing job of advocating for the patient, but sometimes they just don't know what to ask. So one is if there are ways in which we can kind of increase awareness that palliative care exists and that it's not only about end of life, because I think a lot of people have that misconception. So my interest is really how we can improve communication. So as I mentioned, clearly there's room to improve the quality of end-of-life care in general. And my interest is how do we do that through communication and recognizing that things like race and culture and gender, economic status shape people's values and goals, their life experiences, their resources. So how do we be sensitive to those things in a way that we can help patients and families get care that's consistent with their values? So we're focused on what are their lab values and what's the CT finding and all this technology we have and what are their numbers, and not focused on the person as much. And I hope that with increased efforts in medical education to bring that person-centered care back, that we're going to help future physicians be able to navigate that road.